What is a double mastectomy, and is it common to have to perform that if you're considering a mastectomy for a patient?
So if you're considering a mastectomy on the affected side, doing what we call the contralateral prophylactic mastectomy, the other side, is typically recommended in patients, obviously if there's bilateral breast cancer. Sometimes if we find, if they've come in to see me for right-sided breast cancer, I order more imaging tests. If I find something on the other side, then yes, that would be an indication. If it's purely prophylactic, meaning purely preventative, typically it's recommended in patients who have an abnormal gene found on genetic testing. Outside of that, there's no survival benefit to removing the other breast. And what we mean by survival benefit, let's say you're going to live till the age of 90, 95, whatever that age is, you're going to live till then, whether you remove the cancer breast or both breasts. So it doesn't increase sort of our sense of control on the breast cancer, or it doesn't decrease the risk of recurrence. It does increase the risk of complications, right? So if you have one side done, there's a small chance of wound infection, wound complications, bleeding on that side. If you have both sides done, then it doubles the risk of, complications, pain. Although breast surgery is very safe and the complications tend to be low, but doing both sides, double the time of surgery, double the wounds, and double the risk of complications. So, I typically have this discussion with the patients in great detail, lay out the pros and the cons, do their genetic testing, make sure we get, all the images that we need to make sure there's no cancer in both breasts. And then we kind of make a shared decision together about what the best plan is for them. I would say sometimes patients who have normal genes and no family history of breast cancer and no abnormality on the other side, sometimes will choose to undergo bilateral mastectomy, and that's a personal choice. And we support that as long as they understand the pros and cons.